Hello, my name is Miranda, and my project was on why is sexuality often ignored in occupational therapy, even though it is a part of everyday life. Sexuality is an important part of human life that influences identity, relationships, and their well-being. Occupational therapy focuses on helping individuals to be able to do their daily life activities and help their ability to function in everyday life. Despite the holistic approach in occupational therapy, sexuality and sexual health are often ignored. Several reasons contributed to this issue, such as limited education on sexual occupational therapy programs, the therapist discomfort, and social norms. The purpose of this literature review is to examine why sexuality is often overlooked in occupational therapy practice, even though it is an important part of everyday life. Current research shows that occupational therapy goals are to provide holistic care, and sexuality and sexual health are not often addressed during these occupational therapy sessions. One major issue shown in the research done is the lack of education and training on sexual health within occupational therapy programs, which can leave students feeling unprepared to talk about sexual health with their patients. Other barriers include therapist discomfort, social norms, and occupational therapists being unaware of how to address sexual health in practice. By reviewing existing studies, this study aims to identify the reason why sexual health is often ignored in occupational therapy and highlight the places needed for improvement. The findings from the literature review show that sexuality is recognized as an important part of overall health and daily life, but it is rarely addressed in occupational therapy programs to provide limited education on sexual health, with many students receiving only a few hours of information on this topic. Research also shows that many occupational therapists report feeling uncomfortable to discuss sexuality with their patients. In addition, studies suggest that social norms and the lack of professional guidance contributes to the reason why there is a lack of sexual health discussion in occupational therapy. Data from surveys and students show that higher levels of education and comfort on the topic are what could lead to sexual health being addressed in occupational therapy. The results of this study are expected to show that occupational therapists who have more education on training on sexual health and greater comfort on discussing sexual health are more likely to address sexual health with their patients. These findings show that the gap in education and professional support are major factors that stop sexual health from being included in occupational therapy practice. Future research should focus on ways to include sexual health in occupational therapy programs in order to provide more holistic care and truly support patients' daily needs. With the main reasons why occupational therapists do not include sexuality being therapist discomfort, limited education, and social norms.